Let's shut that door if we could, please. If there's noise coming in, we can shut that in too. Okay. All right, everyone. Good morning, Indiana. I understand our technology is working this morning. So hello to those online this morning and to those here in the room. I will call the meeting of the Indiana Commission on Aging to order this morning. And before we start, I want to introduce Katrina Root-Krause, who's here representing Tom Pearson from IHCDA this morning. Thank you. All right. Well, first thing I have to do is call roll, and hopefully we have a quorum. We will find out. Okay. Becky Anspa. Robert Bischoff. I'm here. James Cone. Deb Lambert. Deb, are you on this morning?
I am.
Good morning.
Good morning.
Jennifer Lance.
I'm here. Good
morning. Good morning, Jennifer. Stephen McCaffrey. Dan Mustard.
Recent retirement plan. Can't afford it. I literally had a woman.
Damn it.
A simple plan for a property management company. Went out to one of the employees, and she was a.
Okay, I didn't understand him.
I think Judith came off mute and that was somebody in the background of her.
Oh, okay. I think that's
Joanne, I am on.
okay. Is that Judith?
Yes, it is.
Okay, thank you. Dan, are you on? I don't think so. Okay, Katrina, you're here. Margaret Smith. Megan Springer. Megan, are you on? And Kelly's here. Okay, 1, 2, 3, 4, 5, 6. Okay, we don't have a quorum this morning, so we will have to file our minutes, but does anyone have any additions, corrections, or comments on the minutes? You'll have to approve them at another meeting. If not, okay, we will file them and bring them up for approval at the next meeting. Well, we can't do elections either. We're still looking for a vice chair programs, but we will work on that. And I'll try to have a meeting of the executive committee so that when we come up to the January meeting, we will have a slate again for officers. Okay. Well, in the last few months, I have gotten rather involved with thinking about dementias. Am having some person in my family very much impacted by mild cognitive impairment and possibly on the journey to dementias, unfortunately. As well as just really looking around the state and seeing what we are doing in terms of dementia care and dementia training, where folks are housed at this point in time. Shannon just came in, Shannon Effler. And yesterday I was in a meeting, a training meeting for administrators of both institutional care and more of a social model of care. And well, we have some work to do in the state with dementia care training. And I've been working on a project with beginning to get more training into our curriculum for undergraduate and graduate students in nursing, social work, OT, PT, speech and language. So we are better prepared as people are hired into their positions. So I think there are a lot of opportunities. And as I looked around and talked with some of the people working in the area of dementia training and dementia care services, it gives me a lot of hope in the fact that we have wonderful initiatives going in Indiana. So I had a discussion last week, the last few weeks with Aaron. And so today we're going to hear about some of the dementia initiatives happening in Indiana right now. And so I am just thrilled. So is Kim available? Yep, to come up. Yep. Okay. Great. We're going to ask Kim Woods, who's our dementia care specialist. I'll read this. Senior manager from the Bureau of Better Aging. I have to read things now because we've changed some things up a little bit. So
Yes.
anyway, so glad to have you, Kim.
Thank
And
you.
I didn't know if Erin was going to say something first, but no.
Okay.
Okay.
Hi, I just gave Rebecca, okay, she's on it. She's on it. I just gave her my slides. I was going to present virtually, but computer wasn't cooperating this morning, so I'm here in person. Hello, as Dr. Burke said, I am Kim Woods. I am the Dementia Care Specialist Senior Manager. So I'm going to talk to you a little bit about the program, and for those who don't know, it might be a refresher for others. And then we are going to have space for directly what's happening in the AAAs. And so we have representation from areas 3 and area 2 to share some of the really cool things that are going on, but just giving a little background for the program at large. So moving on, again, that just shows my name and who I am and how I fit into the BBA and this puzzle of the Dementia Care Specialist program. And so just moving on quickly, I wanted to share a little bit about the foundation. Many of you here precede me and we're a part of the creation of this. So thank you for all your efforts and your work. But this program was birthed out of the Indiana Dementia Strategic Plan, led by our coordinator, Shannon Effler. And so we thank her for all of her work and guidance on this program. And so the Dementia Care Specialist program was created to accomplish key aspects of the Dementia Strategic Plan that are outlined in code. And so in 2023, I believe the program launched and was beginning to become established. And the basis of it is to improve Indiana's dementia-related population's health outcomes. The program also supports Indiana's transformation into dementia-capable state. And so we want to equip dementia-capable care and services all throughout the state for all Hoosiers. And so as you see here, the key strategies that were outlined in code, many of them our program directly addresses, and that's including awareness, decreasing health disparities around the state. And so what is always a challenge being in Indiana and being in the capital city, we don't want to hoard resources that only Indianapolis has all the good services and supports and connections. And so we through this program, we want to be thoughtful about how we reach our communities, that we understand the duality of our state. We have many rural populations that need services and care. We want to make sure that that internet and those capabilities are able and there, but also that we're not just relying heavily on technology, but we realize that we have to get people in front of faces. We have to make sure that they have a direct line to even get to those areas transportation wise, that they be able to in a timely and reasonable fashion to make it and get to the care that they need. And so, like I said, this is the basis from where our program extends. And so my role within that as the Dementia Care Specialist Senior Manager, which was a newly created position along with the Dementia Care Specialist program that was birthed through the plan. And so through that role, I coordinate, I train, I provide guidance for our outreach specialists. So our outreach specialists are tasked within the AAAs, and they are employees of AAAs. And so I am that state liaison between leadership here in BBA and beyond, and connect those with the AAAs, with our DOSs, and create that relationship building, that we don't just have mandates coming out of the sky, but that we build relationship, we collaborate, we trust our dementia outreach specialists, that they are our subject matter experts, not only in the field, but in their area. They are keenly aware of what their community needs, and we ask them to stay in tune with what they're hearing from the community as regards to services and where the lack is. And so as that manager, I try my best to do that. I collaborate often with Shannon Effler, our strategic plan coordinator, and make sure that our program aligns with the plan at large, and staying in tune with that, making sure that I'm on the work groups and task force, that I'm hearing the information so that it is not lost in the pipeline to our AAAs. And so moving on, so just to give just a quick overview of where we've honed in, and like I said, we are pulling directly from that Indiana code and what has been outlined for us. And so the things that we have focused on now, like I said, in the program was just established and mandated in 2023. We are starting to hire and become and started to identify the actual people that are going to do the work. I came into this role in 2024, and many of our dementia outreach specialists started to be employed through the AAAs in 2024. So we're just starting to get steam and get rolling. And so we've honed in on some initial areas for the past about year and a half of where we want to go and what we want to see. So the goals are to expand, again, that dementia capable care. Our target audience is the public and the community at large. So when we think of our dementia outreach specialists, we are thinking with people living with dementia and their care partners in mind, but our target audience who we are directly interacting with is everyone else, everyone that's going to support our folks that are dealing with dementia and their care partners. So we want to train our public, our businesses, the other people in the AAA, because many of our dementia outreach specialists, they are not that first point of contact. So even if we can train those who do answer the phones to be able to, low lift, be able to answer some of those dementia questions where they don't have to escalate calls and extend wait times, we want to do that. So our dementia outreach specialists work very closely and integrated with the other employees and their colleagues within the AAA to be able to support that care. And then the community at large, they're attending events, they're providing resources and guides, health providers, making those connections and building relationships there. And so those action items looks like that, being at job fairs, presenting, training, helping businesses become recognized dementia certified friendly businesses, connecting with the other organizations that are already doing this work so well ingrained, rebuilding relationships with the Alzheimer's Association, the Greater Indianapolis chapter, working directly with them, working with dementia friends, building those relationships and extending that network of support so that our folks living with dementia can continue to live in their communities, live with their families, and the families feel supported in doing so. And so moving on, as I said, there was a rollout. These things take time, hiring, and people need to be identified. But we are very happy to say that we have at least, we have one FTE, a dementia outreach specialist is in every area agency. Every AAA has a dementia outreach specialist, and we're very happy and proud about that. Even with turnover, we have been able to refill those roles and have support. And now, as you look at our map, we have 16 AAAs, 18 DOSs. What does that mean? In some areas, they split the role and they support one another, and they do half time to make that full one FTE. And so we have that experience in certain areas, not all, but just wanted to explain that. And so again, we are now cooking with grease, as I often say, as far as being able to say that we are fully, that we have recognize and we're fully functioning around the state. We have those supports, and we're connecting our communities and really relying on those dementia outreach specialists to be ingrained in those communities and in that AAA, every county that they serve, making sure that they're mindful of that and not leaving blind spots and not leaving areas of the state unsupported. And so this program is capacity building based. And so we strive to increase that awareness. We want to expand our resources and supports around the state and make sure that people are mindful that we exist and that we're here. And so like I said, as we begin to be filled and have these roles identified and well-defined, we can work on that. And so what I'm really proud about as we were getting established, moving forward to our next slide, is that the DOSs have gotten to work. And you see this picture here, this is just a few of our DOSs, but I want to make sure that they are seen and celebrated. They are all incredible and amazing. And the really great thing about our dementia outreach specialists, even through the turnover, what has remained the same is that every dementia outreach specialist sought out this role. It didn't just fall into their laps. They have worked in the field. Many of them have been direct service providers. They've been care partners themselves for loved ones. They have been ingrained in this work. They sought out this position. And so they have a passion for it. And so I feel that has been very helpful as we have blossomed, as we have transitioned. Many of our dementia outreach specialists were hired even before I came into my role. So even before they had that direct relationship oversight, they were having to flourish in that role and innovate, and they have done just that. So they're conducting education and outreach activities to increase that community awareness. They are also available to provide support for those that are in the field that are dealing directly with our dementia care specialists. They are coordinating with individuals to create memory cafes and lead those, and they're providing resources for those cafes that happen. They consult with and provide training to many professionals, including the agency staff, but even those that we don't think about, like sheriff's departments. They're being trained so that they don't feel the need to escalate a situation, but they know how to deal with our folks living with dementia. Businesses have called and reached out, realizing that they have seen an influx or a rise in their elderly population and directly seeing signs of their patrons that may exhibiting signs of Alzheimer's and dementia, and they don't want to turn people away. They want to know, how do we care? How do we welcome and make a space for them? And it has been great to see how our dementia outreach specialists have pivoted to meet those needs. And so the other part of this program, the other part of creating that access, is that we make sure that every area agency, it doesn't have to be a cookie cutter. They can keep ingrained in their community and be keenly aware of what that community needs and pivot to meet those needs. So another area, and like Dr. Burke was saying, we are connecting with schools, we are connecting with higher education, and in particular, oh, you don't have to skip. I'm talking here. I'm riffing here. Thank you, Rebecca. We are meeting those needs. We're going to schools. Several outreach specialists noticed the rise in DCS placements with older adults. Grandparents are raising kids, older aunts and uncles are raising kids. And so children are more likely than ever really interacting with loved ones with dementia. And so we're training kids in schools. We have a K through 12 program. Our dementia outreach specialists are connecting with them and identifying how to help. But also for the older kids going into the high schoolers, we can start introducing career pathways that could support this work and open up their mind and expand the opportunity and the idea of working with older adults and be able to fill those gaps in the future. And so we're really great. We feel really great about that and being able to pivot to see those gaps and be able to meet those needs. And so, again, we continue to make sure that we're aligning with that strategic plan, and that fits directly into a lot of that advisory board and the strategic work groups that have been created. And so we are trying very hard, and I'm trying to connect our dementia outreach specialists with those work groups at large, and they were able to, and that's a picture from our advisory board meeting in April. They were able to attend and hear what was happening around the state, and they're really excited, because many times you can get your tunnel vision and you can only see what's happening in your neck of the woods, but to come and see what's happening across the state was eye-opening and really informative. And so with them getting to work, now I'll move on to my next slide. As they've been getting to work, one of the things that I've been tasked with is to identify some of the metrics and be able to share out the great wins and the things that they're doing. And so from all of these things that I said that they're doing, the data and the metrics that we're looking at right now is just a snapshot of what we think most will resonate with our stakeholders, with our legislators and leaders. And so we've taken this and tried our very best to celebrate and show the great work that our dementia outreach specialists are doing. And so when we speak of education, not only are they training others out in the field, but they are training themselves. And so that education piece fits both of those, and you'll see more about that later. That outreach portion, that is also geared towards their event-led things, how they are showing up in their communities, how are they providing resources, and that also, then again, it bleeds into that relationship building. They are liaisons. Just as I am a liaison for them, they are liaisons for their communities at large. We're task them, and we are leaning on them to be aware of what their areas and what their counties need. And so from all of that, from being able to identify those things, we've honed in on these specific metrics that we look at for our data tool right now. So we're looking at communication, and that is community feedback. We want to know how they're showing up and how the desire for the program, how that exists. And so breaking these down into those categories. With the communication, we're looking for how the DOSs are operating that liaison role, what the community feedback around it is. Are people asking for trainings? Are they wanting them to come back? Are we having that snowball effect with our word of mouth, our businesses telling other businesses, we've seen positive change because of this? And especially in areas where law enforcement is involved, that word of mouth has been awesome. One sheriff's department has a great experience and they share, and then they don't gatekeep and they allow us to come in. That has been a great area where we've seen some snowball effect and getting that word of mouth out there. And so we want our legislators to know that people are asking for this program. And as we all are aware in the aging community, without a cure right now for dementia, our numbers are only going to grow. We're only going to need more of this work. And so I feel that it's really important that we keep that in the conversation, that people are asking and they're requesting this information and this support. And so that engagement, we want to know what events they're holding, who's attending, the reception of it, what kind of efforts are going into that. And then again, that last piece is that professional development, because we know they can only lead with the information that they have. In order for the DOSs to be able to educate their community, they have to stay well informed on dementia knowledge. And the fact that there is not a cure, the fact that there is not, this magic switch that we can turn on and end dementia, we know that innovations are happening every day. Research is constantly happening. And so we ask them to be at the forefront of knowing that information and being able to dispense that around the state.
Kim, can I ask
Yes.
a question? So incredible, absolutely amazing work across
Thank
the
you.
state. Love the fact that you guys are going beyond just supporting caregivers and
Mhm.
really trying to broaden education and understanding. When you talk about some of those KPIs,
Yeah.
how concrete are you getting to surveys of participants, community participants around broadening of their knowledge and understanding? Like, how concrete do you get to really understand the level of impact?
Right.
Like with the Sheriff's Association,
Mhm.
right?
We're still learning, and our data tool, I always say that it's a living, breathing thing. Like we're constantly changing it to hone in and get to the heart of it and the meat of the data. What I will say is we're trying all different types of things. So as I'll go on, I'll share that we present, they submit this year. So we just started the data tool this year. So we just started in January. Yes. So we have three, they just submitted their third quarter of data going into this end of the year. And so what we're learning and what we're seeing has been very encouraging. And what I do with the data tool is I always let them know they can give me other things besides the tool. The articles that they have, family letters, and I tell them redact whatever you want to redact. We just want to get to the feedback. And so we are seeing some really great specific examples, but at large, there's still so much more to know. And we're hoping even in 2026, I just met with them literally yesterday. I met with the dementia outreach specialist. We meet monthly, and we were brainstorming ways to, again, fine tune this tool and make sure we're getting to the heart of the data. But we have gotten some really great numbers, and I'll share a little bit about them in a couple more slides. But yes, but it is something we're constantly we're looking into. We're trying to figure out how do we really get to the heart of what we really want to say, what they're really doing. And so, yes, this is the very next slide. So I just entitled this Incredible Results. This was just Q1 of this year. So I met with all the dementia outreach specialists in the month of December. I let them know, introduce that, hey, starting 2025, this tool, we got to get some data for our leaders and our legislators. And they really did it. They did a bang up job. And what they were worried about is many of them, like I said, they were hired, same with me, 2024. So they weren't sure, like, what are our expectations? What do you want to see? But we started off no expectations. We just want to know what's happening out there, and that will help us inform what we do moving forward. So just in Q1, nearly 6,000 Hoosiers were reached through our program in that quarter. And when we say Hoosiers, again, we're talking about that public-facing entity. That's what we're here to support. So we're talking about training AAAs. We're talking about reaching out to businesses. We're talking about connecting with EMTs, getting information and resources, providing for when we have community fairs and resource fairs that we are contributing to those. And just in Q1, so that's January, February, March, which is a challenge for everyone in Indiana, they still were able to produce and do some really great work. And so they've connected with businesses and really reached out. And I'm proud to say that January and February are the two lowest months that we've had so far. This is the lowest example of our engagement, and this was already great. So we're really proud of the work that they're able to do. And so we were already starting to see, if you move on with that feedback, we were already starting to see some positive responses to the program. And they were just a few months in, and people are already calling like, hey, we saw this, we saw this event, we saw your name on a pamphlet. What's going on? How can I get help? How can we get training? We're seeing these things. Where can we get supports? And so that has been really, really great to know that even early on, we were already having a positive community response from it.
Kim, I'm so sorry, one more question. Can we go back one slide?
Yes.
So there was dollar amounts there, so total.
Yes.
So is the 1.27, is that the state fiscal year total budget for this?
Yes.
Okay.
Yes. And so that's what's and so then the 79, that's what's allocated to each of those
AAA.
AAAs.
Okay.
Yes. Mm-hmm. Okay, so we can go, and yeah, we'll go one more. Yes. I think we went too many, but that second one is this. Oh yes, this was Q2. So that first quarter, were able to reach about 6,000. Quarter two, 10,000, over 10,000 Hoosiers were reached, participants of those events, those community fairs. And if you see in the middle, we have both quarters together in that graph down at the bottom, the bar graph. Those two peaks in the middle, that was the spring months, and that's when the best time to target the schools before they got out for summer vacation. And so we saw a peak of engagement there, and what we're really proud and excited about that. And we had some of our dementia outreach specialists that have seen that have had success in interacting with schools. We had them present for our other, for all of our DOSs to kind of encourage them to go in that vein. And so we're hoping to see more of that in the coming year. And so, again, and so moving on with those, you know, we're seeing all of that action, all of these events and participants that we're having. People are coming out, people are knowing, people are grateful for the resources. And so we want to celebrate that we are seeing an increase because, again, the need is there, the need is great, and we know that there's more to do. And so moving on, we just want to show that they are still seeking education and information. And so what that tells us is some of these dementia outreach specialists, they're already a year in. So many people think, oh, when you get a new job, there's onboarding, there's this. With the work that they're doing, there's always more to know. There are more things to research and understand. And not only are they getting credits or, you know, increasing their profile on a resume, they're also taking trainings that open up new streams of resources, that open up access to information, that give them new connections and new collaborators that will now work with them because they participated in these events. So they are constantly innovating. They are constantly seeking out opportunities to expand what they do and how they do it and be able to meet the needs of their AAAs. Many of them have taken courses that have led to streams of grant funding being accessible and available. And so, you know, in the world we live in and in the, you know, confines of our funding, that is a great benefit that they are seeking out those opportunities. And just moving on, just one more slide about the feedback. I just like to show that the program is being felt, and we are seeing that not only are we seeing thank yous coming in, we're seeing families saying, I feel supported. I didn't know if I would be able to keep my loved one at home, but you helped me find these resources. We're hearing stories like that. We're hearing stories, like I said, I shared this at the conference a couple weeks ago, how a restaurant reached out and they wanted to be trained. A patron was showing signs of dementia and they didn't want to turn him away. He was a regular. They wanted to keep him, but wanted to give him supports. And now they're going through the process to become a dementia-friendly business. And, you know, so we're seeing great examples of that. And so even in quarter three, when you think, oh, everyone knows, no, there's still people that need to know about this program. 600 businesses, community partners, and people living with dementia and their care partners reached out across the state just in quarter three, seeking information, seeking knowledge, and seeking more training. So we're really glad about that. And so I'm wrapping up. I feel like I've been talking forever. I'm so sorry. But wrapping up.
Passion, that's wonderful.
Thank you. But just want to say the last part of my role is really building trust and working with a lot of folks. And so you can't find me, but I promise you I'm in this picture at Advocacy Day here at the State House. But I wanted to show that a large part of my role is not just providing that monitoring and the oversight and resources to our dementia outreach specialists. I'm also, again, that liaison and that go-between. So I need to know and be informed about what's happening on the state side and what our leaders want and expect of this program and of our dementia outreach specialists. And so being able to be informed in that and continuing to work with internal and external partners, collaborating with organizations, working with groups to build the program and make the program broader for the Dementia Strategic Plan for our state. I partner with I4A, I partner with the Marion County the public health department with the BOLD initiative, also known as Vital Minds now, working with, again, with the Dementia Strategic Plan work groups, the provider education work group, which we are now connecting with our dementia outreach specialists so they can collaborate on their education efforts, because education is such a big focus for the DOSs, working with WISE and helping. I came in at the tail end, but it was really great work of working to create that dementia dashboard, which we someday hope to have funding and have live in the state of Indiana. Working with the increased geriatric workforce task force. And also one that I really love and has been near and dear for Shannon and I is working with the public awareness of people living with dementia, health equity and care partners work group. That has been incredibly informative because we get to hear real world examples of what our policies and what our initiatives have the impact that they have on people's lives. And so keeping them in the conversation is imperative to the work that we do. And so, as I stated, I've been in my role since last July, and I'm learning and still making connections in this work. And as I stated, I didn't state this. I normally talk about my employment of being with the state of Indiana working for them for the past 15 years, but in this role, a little less than a year and a half. And so this position with Division of Aging has been a whole new world for me, and working with the AAAs and working with the dementia outreach specialists and Shannon has just been so important for me. It has been great work, and getting to know all of these organizations has been very meaningful. And I've met some of the most passionate and dedicated individuals, truly committed to serving Hoosiers affected by dementia. And we've made a lot of headway, as you see, and we hope that we have, and we know that we have much more to accomplish. And I'm honored to work with these enthusiastic individuals. And so thank you for listening to me and rambling on. If you have any questions for me, I have my contact information there, but I do want to make way for our next presentations out of areas 2 and 3 that are doing some really great innovative work, and we want to speak to those examples and want to give them time to do that, especially in the way of guide, as we discussed. And so, thank you.
Well, thank you for your very passionate presentation. It's exciting what's going on. It really is. I think you know from my comments at the State Conference on Aging, in the 1800s, we didn't have a concept of childhood. In the 1900s, it took us about 100 years to develop our communities to accommodate the concept of childhood into them. Look at all the services we have and amenities we put into our communities. Well, this century, we have more of us living longer than ever before. Of course, we don't exactly know what to do with this. We're learning and we're developing things. And it is a very exciting time to be alive and see some of this go on. And so as we kind of have bumped along trying to figure out what are our federal legislation on the Older Americans Act, what impact does that have on this century? Our area agencies on aging are tasked with let's work on aging and what it means in our community. They're partners right there embedded across Indiana, and it's exciting to see some of the work that's going on. So we have a lot of wonderful things happening. Angel Baginski, you are next on the agenda here from Alzheimer's and Dementia Services of Northern Indiana. Good morning, Angel.
Good morning. Thanks for having us. That was awesome, Kim. Thanks for all the hard work that you're doing. We love our dementia outreach specialist up here. She's watching, so I have to say that, right? I'm just kidding. We love her. I'm going to share my screen, and I'll try not to take up too much time. But I want to tell you about some of the stuff that we're doing up here. Hold on, you guys are in my way up here. There we go. Okay, can you guys see that? Yes. Fingers crossed.
Yeah.
Okay. As Dr. Burke said, I'm Angel Baginski, Director of Alzheimer's and Dementia Services of Northern Indiana. And some of these other logos on the screen are some things you might know us for. So we are very proud to be part of the Area 2 Area Agency on Aging. And Institute for Excellence in Memory Care is one of our programs, as well as Milton Village. So I also feel really strongly that I am not a lone person. This is our team. So without all of these people, every single one of them, we couldn't do what we do. But on that note, we are a very small team accomplishing some of these things that we're going to talk to you about. So this is a picture of all of our team. There's Judy. She is our outreach specialist. Shout out. But here at Alzheimer's and Dementia Services, we are very lucky to be our own division of a AAA. But here, just to run through for you, these are some of the core things that we do that support our community and our folks living with dementia and their caregivers. So we offer certified MoCA memory screening. So we do outreach in the community and let folks know that we are able to offer. I'm sorry, I'm echoing. Able to offer early cognitive. Can you guys hear the echo?
Yeah, I can hear the echo, Angel, but it seems like there's an echo coming from the room.
Okay, I just want to make sure it wasn't just me. Okay, so the early cognitive memory screenings, we have 3 certified screeners, and they go out into different organizations, different senior centers, and they offer these screenings. And we've been able to educate through our dementia outreach specialist, the physicians' offices, primary cares, neurology. And so we actually get referrals in now from these physicians to provide these screenings to their patients so that they have the screening before they actually even hit the office for an appointment, which has had huge success. We've had folks who didn't score well on their memory screenings take those results to the physician, and the physician in for example, one instance looked at the screening, went through the medications with their patient, was able to adjust some medications. The client that we have said it lifted her brain fog, and she scored perfectly on her next MoCA that she did. So what a huge service to the community and to that person to be able to find something. I mean, she did not have dementia. She just had some medication issues. So it's scary for people to think that they may have dementia, and sometimes these screenings, and we educate them like, this screening doesn't necessarily mean you have dementia. Use it as a tool for your physician. So just in the month of November, we've done over 77 screenings in the community. And more to come all the time. Our care safety bracelet program, our dementia outreach specialist, Judy, is the know all be all of this one. She goes out and educates first responders, community partners on this safety bracelet. It's a very, very low cost, low tech resource for our community to have identity information in case someone is lost or wanders or needs that support, or even if you don't have dementia, honestly, if you're found unresponsive, these bracelets offer a very easy identification. So you know this person's name, where they live, they have, what their diagnosis might be, so our first responders or other community members can support each other. The goal of this, it's great that the first responders use it, but the actual goal of this program is to educate other people in the community to be able to help each other, so that we don't have to call a first responder and cause trauma for a person living with dementia. We can simply scan this bracelet and see that person and know who they are, contact their emergency contact, and get intervention, ideally without even having to involve first responders, and use those dollars of community resource, and they can be used other ways. So more information if you want on that, just let us know. We do have actually 30 support groups that we support throughout our service area. We do use the ABC Care Coaching model for our stress reduction program up here in Area 2. We do have some certified evidence-based programs. Also, we are Chair One Fitness instructors. We are Health Rhythms Drumming and Wellness instructors. Those are both evidence-based programs that we offer to our caregivers and community at large. We do presentations at Lunch and Learns. We have multiple family caregiver meetings. We have a licensed clinical social worker on staff who provides family caregiver meetings and actual caregiver counseling to those who need it. Resources and referrals. We connect people throughout our service area and other service areas that we know of. We connect them to other AAAs if they're in area 1 or 3 or wherever they are. We connect those folks. We do have a toll-free helpline. So 24/7 help, not 24/7. We have a helpline where they can call and get resources and referrals. We do send out quarterly newsletters. We do celebration events for our caregivers because they really need just that time to celebrate themselves. And just most recently, we have embarked in the guide program. And I won't go into that too much because I know that Area 3 is going to cover that. But we are also a provider of guide services here in Area 2. So one thing that we do look at is our mission. And I really, as Dr. Burke knows from yesterday, I really promote having a mission. And so for our mission, we look at 3 things when we look at what it supports. Is it supporting education and connection within the community? Is it supporting health or early detection? Or is it an innovative and advanced dementia or care partner model? So it has to meet one or all 3 of those for us to consider adding it to our repertoire of services or programs. So some of the things that we've done, and if you've seen this, bear with me, but if you haven't, Milton Village was a huge step for us. We were looking at new and better ways to make things non-institutional within our community and for care of those living with dementia. So I just have a little brief video. If you haven't seen it, I'll play it for you. Just gives you a quick little visual of the village. So
Diagnosed with
sorry,
Crohn's
we have to
disease
learn
and
about
struggling
Crohn's
with your
disease
symptom,
for a minute.
it's not too soon to talk to your doctor about Entyvio for moderate to severe Crohn's and learn about the
There
Back on
we go.
Father's Day weekend, Caroline, my son Colton, and I participated in a Howard Park fundraising event for Alzheimer's and Dementia Services of Northern Indiana. We served as MCs for the event.
And last week, we got the opportunity to tour the organization's day center here in South Bend. It is truly an amazing facility, and we're excited to share it with you. Walking through Milton Village, there's nothing clinical about it. It's a real community that's supporting seniors in Michiana every day.
You don't have to be a caregiver. This is a community center for people to come in learn about Alzheimer's.
Over 7 million Americans are living with Alzheimer's disease. And the director of Alzheimer's and Dementia Services of Northern Indiana, Angel Bajensky, says, the more the community can educate themselves, the more helpful we can be towards caregivers and those living with dementia.
And I think we're taking baby steps towards it, but there's a long way to go. And that's part of our mission here is to help the community understand that's not a stigmatized affliction.
Caregivers can drop off their loved ones for the day at Milton Village for $75. Here, they can get their haircut.
A licensed cosmetologist who takes appointments and does hair. She was here this morning. She does charge for her services, but I mean, pennies.
Play pool. Express themselves creatively with art classes.
They make amazing painting things and they're very talented.
Or take a relaxing stroll in the outdoor garden.
So there's no other center like this using this model of normalcy and inclusion and socialization that we use anywhere in the world.
But again, it's not just for those with dementia. Caregivers can come to the facility as well, with many choosing to book time to take a nap while their loved one is being cared for.
See it, come tour it, come find out what we're all about.
That was
It's
really,
amazing. I was so impressed with it.
and I think what I was touched by, and I was just saying this to you, the passion of everybody who works there, the caring, and then the fact that everybody there is so obviously treated with dignity.
Absolutely. Remember the man we talked to when we were leaving, his wife goes there several times a week, and he said that this facility has been a game changer for him to have. She looks forward to going, she's engaged, and
And
Yeah.
that's really key, is having people looking forward to being there.
Absolutely.
Well,
So that's our village. If you haven't seen it, come see it. We also, our village especially, but also Alzheimer's Services, we operate very heavily on volunteers. So we engaged multiple volunteers throughout all of our programming, caregiver services out in the community. We do work with the colleges up here. Notre Dame does a lot of research projects with us. I'm going to show you one that they're working on with us that goes right along with some of the programs that I heard Kim talking about. St. Mary's is working with us on our education projects. We have a lot of interns that come through social work, occupational therapy, nursing, speech pathology, music. There's not probably ever a time that we don't have at least 2 interns somewhere in our building or working with us. We do educate our community with dementia friends as well. And something that I was pretty proud of is when I was looking at all the great things that happen in the field of dementia, there's conferences that happen and they happen on the coast or the big cities or whatever, but nothing really was happening like here in the Midwest in our area. So we created the Midwest Dementia Summit because we were interested in what everybody else is doing and what's innovative and what's non-traditional. Let's get past that. There we go. So the Midwest Dementia Summit we had in 2024, which is coming again, and it had a great feedback. So if you weren't able to attend, hopefully you can. But this is one of the programs that we're working on with Notre Dame. And the Hesburgh Library has a virtual reality, just a whole division of amazing things that they do. And so my thought was, who are the people who are seeing our folks who are living with dementia, right, in the community? So we do Dementia Friends with restaurants, with banks, with grocery stores. And those are the places where some of our young adults, our students, our graduates, kids in high school are getting jobs. And so how are we supporting them and educating them on what they're going to be encountering? And so that's where this came from. I see kids using the virtual reality, the Oculus headsets and playing games and things like that. And I'm like, well, what if we created a virtual program? And so there's some online that you can see, but they were really kind of cartoonish and not really well developed. And so I challenged the Notre Dame folks and I said, I want it to be more realistic, and I want kids to be able to use this headset and get a real feeling for the empathy needed to engage in communication with folks living with dementia. You don't have to come out of this perfectly knowing everything about dementia and types and stages and all that, but I want you to have that empathy feeling when you come across someone with dementia that's trying to count money and get their groceries, or that's ordering something at your McDonald's station, right? So we've been in communication with the South Bend Community Schools up here and working on a curriculum that would also support this, that they can put into their early workforce development. So they have students who spend half a day in school and then half a day at work. Or they also have a medical magnet school here. So we're thinking like your CNAs, your workers who are doing that. And they're very excited about the fit that this has. So working with us on developing that curriculum, while Notre Dame works with us on developing the virtual reality program. Another program that they're working on through Notre Dame is AI socialization robots. So these are robots who have life histories downloaded into them and can communicate with people who are living with dementia. So that's something that they're trialing up here at Milton Village, and we're very excited to see how that goes. They're using it at the University of California in some long-term care settings. And so they're also trialing it up here in this day center setting. So we're pretty excited to work on that with them. And then St. Mary's College, I think Dr. Burke hinted at this a little bit earlier, is One of the things that we really desire in Indiana is a consistent educational platform. And so that's something that we had noticed back in 2015, 16, when we developed the Institute, that was kind of lacking with our professionals, is a really streamlined, in-depth education. So we developed the Institute for Excellence in Memory Care. This offers dementia certification. So there's several places who offer dementia certification, but the uniqueness about this is 21 hours of in-person dementia education. And you think, oh my gosh, 21 hours, that's a lot of commitment. But what we're hearing from this is the extreme satisfaction of the people who get to take this program, to be able to interact with other people in the program, bouncing ideas off of each other, learning from each other, understanding the steps involved. This is a 2-part stacked certification. So you can take the basic CMCP at 21 hours. You can then add to it 14 more hours if you're a memory care director or a professional administrator or someone of that nature, which is what Dr. Burke did just over the last 2 days. So she can fill you in on that. But this program, we're looking at adding it into higher education platforms where students can get a 1 credit hour credentialing from this that then would be able to be on their resume. So when people in the community are hiring someone who has dementia care experience, they're able to click right on that badge and see the extent of education. Like, I didn't just take, a course for 8 hours online and pass a written test. And, I've never even talked to someone with dementia. This has all of that didactic learning plus an experiential component to it, to hopefully give them a better base for their education. We're working now on launching this program nationwide. We've been training people throughout throughout Indiana for several years now. Actually, some of our dementia outreach specialists have also been through this program. It is endorsed by Be Advice, and Be Advice are the people who developed Dementia Village Netherlands. So they took this training back and they said, if you want to move towards providing the care standards that we provide in this normalization, this model that we use here at the village, this is the training that does it. We are the only training endorsed by them in the United States that we're aware of. So this is an education professional platform. And then, as I mentioned before, the Dementia Summit 2026 is coming up. This will be another really great, we've actually had to expand it to a 2.5-day summit. Save your dates. It's October 6th through 8th of 2026. You can go on the website currently and sign up to be, kept informed of what's happening with the summit. You can sign up on that news feed. We're getting ready to open up our request for proposals. So those will be opening up about early December. So if you know of a really cool, innovative program that's just different and outside of the traditional box, that's what we're looking for. That's what we want to hear. We have our keynote speakers now lined up, and so those will be posting to the website pretty soon. So stay tuned on that. But we're really looking forward to another really great summit this year. And then, like I said, just starting with the guide program, but we will let Area 3 take it from there and talk about guide. Any questions about what we do up here? I haven't hinted out that we are working towards creating our very first residential dementia village. But that has been in the works for about the last year. So now I'm excited to say it's coming. I don't have details on it yet to share with you, but as with the Dementia Village Netherlands, where there's a 24/7 living center, that is coming to Indiana. And how exciting that Indiana is able to have all these things going on, right? So, questions?
Angel, absolutely remarkable work. I want to come up there and work, actually.
Bring it on.
Have any openings for a social worker?
Yes, ma'am.
Abs-
Come on up.
Absolutely incredible work. Thank you for your leadership and for the entirety of your leadership team for the work that you're doing. I know you are obviously within the AAA, but can you tell me a little bit more about how you're funding all of this incredible work?
So,
Do you have private partners?
So to be fair, Milton Village was very heavily funded by private donors to create. But it did stem from the St. Joe County Community Foundation. They were our seed grant for that. So when that was proposed, and that was dreamed up, they had a senior initiative grant that came about. It was like a perfect storm. I like to tell people of, we needed to move out of a building that was just rotting away. Dr. Burke and myself had seen Dementia Village. I had been passionate from 2018 when I started that dementia needed a change because I had been a director of nursing and long-term care, memory care units, assisted living. I'd seen it, was not super impressed. So all of that came together, and the support of the AAA that we had here, the support of the folks at Center for Hospice who owned our day center that we managed, it just all pulled together at one moment. And we were able to pull that together and present it to the community at large and the community foundation. And then it really took off from there. So does a dementia village need to be as absolutely fabulous as this one is? It does not. There's because when I tell people that this was a $6.1 million project, they're like, how are we supposed to do that? You do not have to spend that kind of money. We're a very donor heavy county up here, so that did help. But our original budget for this village was about $3.5 million start to finish. But then they added some really cool things. Also, community involvement. So we have buy-in from our community resources up here, our history museum, our Studebaker Museum, our Catholic charities. I mean, all these people pulled together to make this happen. And that's why with this Dementia Outreach Specialist program, community involvement is huge. We do use the Title III Older Americans Act funding for some of the salaries of some folks, but we also do specific dementia fundraisers that fund all of our caregiver programs. So when you saw that news clip, they were talking about emceeing our walk. Our walk raised $76,000 last year. So that funds our caregiver programs, all the things that we're able to do, the ability for us to pay for certifications and memory screenings to get that certification going. But all of the things that we do are free to our caregivers. So yeah, people ask, well, how do you fund that? And it is through a lot, the Older Americans Act. Our outreach specialist is on staff with us. That's funded currently through the state of Indiana. We so appreciate that, right? But fundraising is a huge part of ours. We have a benefactor packet that we put together. So we're able for our outreach specialist to also, as she's going out into the community, to leave benefactor packets. We have legacy giving. We have folks who have donated to a legacy endowment that then funds us. We have folks who specifically give to Alzheimer's and dementia services through their memorials, and like right now is November is the give back time for everybody at the end of the year. So we've received several donations from people, and that has just really climbed with this community outreach effort. When I started, those things were very minimal, but now that we're out in the community and we're doing things and we're informing people and letting them know that this help is there for them, those donations have really climbed. So thank you. That's an excellent question. Any other questions?
Okay. Hey, well, Angel, thank you so much for your presentation. I just want to make a comment and a point here. I saw this program grow from an idea to this. In 2018, my husband and I took a trip to Europe, and he had heard me talk about the Dementia Village outside Amsterdam. And the trip started in Amsterdam. And he said, we're going to go early, and you're going to go out and visit the Dementia Village. I said, we have to pay to do that. I'm not, $1,200. Are you kidding me? He said, no, you really are interested in this. He said, yeah, we're going to go for the day. And we did. And we met with one of the women that had a woman who had founded this. I brought the concept. I was really impressed with a different way to go about services for older adults who were living with dementias. I brought the idea back to Becky Zazik, who was the CEO of Real Services. You can imagine me on their board. It was anyway, and my passion. And anyway, just brought the idea back. This came out of the work of that AAA in that local community. Voters have brought everything back to the local community now. If we're sitting here waiting for federal and state funding for things, nothing's going to happen for a while. I'm not saying it never will. I'm just saying at the moment, we're back to the local level. This came from that. So if you wonder why I'm around talking about this is the century to do things to bring in amenities and services in our local communities for the oceans of people like me, older adults, this is an example of it. Now you heard what she said. They had a budget of $3.5 million and people came in on top of that. I said to a developer, and I'm going to use this, I'm in our most affluent county in Indiana, Hamilton. Yesterday, I said to a developer, you're still building things that fit last century. And I said, people like me aren't going to buy it. Don't park me in front of a TV. Don't age segregate me somewhere. We're not going to buy it. Well, that gets attention. All of a sudden, oh, you won't buy what we're building? No, because you're not making sense for today. You're built for last century. But we have to do things. We have to do things like create this adult day up there. And their array of services for family caregivers. And then they're probably going to, looks like they've got an potential possibility up here of doing a residential dementia village. Can you scale that? I don't know. We got to figure some things out. But we have, I was thinking housing, affordable senior housing. So those bracelets, that's something that would really be interesting. That we can learn the synergies we can get by sharing ideas around the state with things. I mean, yeah, it'd be nice if we had government funding coming down. We're not going to have that in the United States for a while anyway. But let's see what we can do in our local communities. And I understand not all communities have the resources in them. That's why we ended up going to state and federal funding for some things. We have to work some things out. But let's get something going that fits the needs of this century. And so anyway, I did get interest. Yes, they said, you won't buy what we're building. I said, no. That was interesting. So, but we have to help people see it. And those of us who work in it and have worked in it and have studied it are the ones that are going to have to bring the vision. Anyway, thank you, Angel. Let's go to Fort Wayne and see what they're doing in Fort Wayne. Beth, are you on? And would you introduce yourself, please?
Absolutely. So I am one of two Beths actually at Aging and In-Home Services. My name is Beth Evans, and I am the president and CEO of Aging and In-Home Services. We are pleased to be here with you all today, and thank you for inviting us to share a little bit more about our guide program. With me today, I have our SVP of Integrated Care and Research, Chris Forcucci, and she and I will kind of share the stage here to talk a little bit more about our program. So I think I have shared my screen. Are you guys seeing the slides?
Yes.
Okay, great. We'll jump in. So GUIDE, I always like to define an acronym. GUIDE stands for Guiding an Improved Dementia Experience. And I'm a few slides behind. This is who we are. So in 2024, AIH was selected as a lead participant in the CMS GUIDE model demonstration. One thing that is nice about being a part of our demonstration project is our ability to, do the model, do all of the steps, but also be able to formulate and shape how the program is going to look in the long term. We're able to live in it, provide that feedback, and help be a part of the proof of concept, and which in the end not only helps to serve patients, but then also saves money and is better for our communities. So we were one of a little under 400 organizations to be selected as a lead participant in this model nationwide, and one of only 5 area agencies across the country in this role. And so for Aging and In-Home, the GUIDE model of care, our next step in the integrated care strategic planning that we have this time. We'll spend just a little bit of that. 15 years ago, we decided to make a purposeful commitment to integrated care modeling, and we completed strategic planning and discussions to that end. And as a result, we're proud to have been able to spend the years following moving to achieve that goal. In 2011, we launched a care transitions pilot with Parkview Health. And in 2013, we were selected by CMS for the Community Care Transitions Program, which was very successful and really helps to show the benefit of that to our communities. In the years following, we worked with NCQA on developing the CM-LTSS accreditation. We achieved our Medicare provider designation and programming to that end. And in 2021, we opened a program of all-inclusive care for the elderly in our region in partnership with Parkview Health. And so GUIDE is our latest integrated care program to inform care. So we know the goal is to provide person-centered care, breaking down those between services to improve patient outcomes, satisfaction, positively. What we know is across the country, nearly adults are family care, providing care support for people with disabilities. Of course, of that, nearly 6.7 have related Alzheimer's, which is projected to more double by 20. So when we look at the dementia, we know care and typically they need a comprehensive caregiver support network that is not always available. GUIDE helps to fulfill the need in providing coordinated dementia care model that offers evidence-based services, care navigation, 24/7 access to support for that family caregiver support. And Chris is going to go into a little more detail, but those social supports coupled with the clinical care are really what helps us drive it forward in making the biggest impact with this GUIDE model. Chris, I'll pass it on to you.
Thank you. I am thrilled to be here with you. I'm sitting here smiling a little bit after you were so passionately sharing your vision on and getting that to fruition in the South Bend area. That's sort of the take we took on this as well. We knew when the information came out from CMS about GUIDE that most of those 400 groups that were selected would be healthcare systems or physicians' offices or hospice programs. And we just decided we had been doing the social side of the work with, as you saw laid out there by Beth, with this population, with caregivers and folks with dementia for many years now. And we were going to take a chance, and they were going to either see us as innovative or crazy. And so we decided that we had the social piece down. If we were selected, we would then spin up the clinical side. I'm a nurse as well, so we had some experience from the clinical side, but first time we'd ever spun up a clinic. But we're so tickled that we did. So this is just a visual that shows the experience of the GUIDE program, sort of your common dementia experience versus ours. And I just want to share a story. So and I'll get into numbers, but we just started our GUIDE program and saw first patients in August, and already have seen amazing benefits to the folks we are serving. So for example, one of the caregivers said to us, you know, we've been to a neurologist, we got the diagnosis from the neurologist, but they only want to see us once a year. And they want our primary care doctor then to provide that ongoing care in between our visits with the neurologist. Unfortunately, the PCP was not comfortable doing that. So what our GUIDE clinic has sort of become is that bridge to assist those caregivers and individuals with dementia throughout the year. And we provide very much more hands-on, not maybe in-person hands-on, but more hand-holding for the caregiver. We're able to call out, follow up. We had a caregiver recently who called in because her loved one was experiencing a lot more agitation. And so our clinical staff was able to work with the caregiver, prescribe a new medication for that individual, and then our nurse practitioner calls routinely, you know, every few days after that prescription was started, to make sure that the caregiver is seeing improvement and that things are going well. And the nice piece about that is we were able to do all of that via telehealth. We'd already met the patient, then we're able to follow up via telehealth with the caregiver, which meant she didn't have to bring them in to the clinic, which was also a situation that would have added to their agitation. And so it's just, the caregivers are just really, really enjoying what's happening. Next slide. Thanks, Beth. So what is the eligibility for the GUIDE program? The first bullet there, must have traditional Medicare Parts A and B, is probably the piece that's the biggest sticking point at this time. One of the pieces that we hope will come out of this demonstration project is that CMS will be able to open GUIDE beyond just traditional Medicare. But at this point, I know in our region, in Area 3, we're about 55 to 60% of the folks on Medicare in our region have MedAdvantage plans. So if they are on a MedAdvantage plan, they are unfortunately not eligible at this point. They must have either a diagnosis of dementia or at least have a cognitive impairment. Our nurse practitioner, when they are assessed for the program, can then attest to the impairment. So they do not have to have a specific diagnosis when they're referred to us. And this slide says must live in the AIHS GUIDE service area, which is correct, but our service area is the full of Indiana. And we have a few counties. We looked at the contiguous counties in Ohio, because as Beth mentioned, we did the Community Care Transitions Program back in 2012 and 13, 14. And Parkview, if Fort Wayne sits really close to that Ohio border, we had a lot of Ohio folks coming to Parkview for services. And we had been declining them because they weren't in one of our counties. And one day it dawned on me, wait a minute, this is a federal program. They don't care about the state line. So we checked with CMS and they said, absolutely. If they're being served by your hospital, you can absolutely include them. So we knew ahead of time. We're now partnering with we're going to be partnering with one of the AAAs on the other side of the state. And so they've asked us about going into Illinois, and we'll be partnering with the AAA down in the southern region. And so we're considering Kentucky as well. So right now, Indiana, I don't know, who knows in the future, maybe the world. It's hard to tell. They must live in the community. They cannot be on PACE. Excuse me. They cannot be using their Medicare benefit for hospice, and they cannot be in a nursing facility. But they can have the GUIDE program in conjunction with Medicaid waiver programs. So that's a nice benefit for those dual eligibles. And it doesn't require a caregiver. So we have some folks who participate just as the individual with dementia. But if there is a caregiver that's involved and they want to participate in the caregiver side of things, then they need to be willing to provide their information to CMS as well. And unfortunately, part of the process is CMS actually makes the final determination to what they call align that GUIDE participant with our program. So we do the assessment, we do an eligibility screen that shows whether they meet sort of that, do they have the right kind of Medicare, do they have cognitive impairment or a dementia diagnosis. And then we do assessments as they're outlined by the GUIDE by folks at CMS. We submit that information to CMS, and then they say yay or nay. They can participate in the program. And it's usually, if it's a caregiver and a participant, then it's usually, they look at a combination of both the level of dementia and the degree of stress that the caregiver's seen, so that they end up sort of tiering those folks in those two criteria. Next slide, please. So some of the benefits of the program is the care coordination. We really, and this is the piece we loved, we're finally doing integrated care. So we provide both a nurse practitioner. We have a medical director who's also a hospitalist at one of our local systems, and he is wonderful. He works directly with our nurse practitioner, whose background is home care and hospice, has worked very closely for many years with these same individuals in those settings. And so our nurse practitioner, Kelly, provides clinical assessment and oversight of the dementia. And then our care navigator, who is ABC Community Guide certified, provides that social support, caregiver education, coordination of resources, and really is there to support that caregiver. We have person-centered care planning. The care navigator, after the initial assessment where the nurse practitioner is very involved with the assessment of that patient, then the care navigator actually follows up generally with monthly follow-ups with the caregiver and care recipient. They do counseling and education as needed for the caregiver. And then everyone receives a yearly assessment again from both the care navigator and the nurse practitioner to ensure they're still eligible. And as I talked, there's sort of those tiers. As the dementia progresses, they may move into a higher tier, which would then potentially qualify them for additional benefits. The one thing we really liked about the GUIDE program when we were thinking about applying for it, we've had several projects in the past. We just finished a largely funded grant from the Administration for Community Living that worked with the same population, but that was a 30-day program. This program is ongoing. As long as they complete that assessment, CMS reviews it and aligns them with our program, they could be with us literally for years. So to be able to stay with that caregiver and individual, to support them, as we know the dementia will change over time, is such a wonderful benefit. Excuse me. And then for caregiver services, I already mentioned that we do the ABC Community Guide model, which was developed at Indiana University by Dr. Malaz Bustani, who we love and have worked extensively with. But there's also a respite benefit, which for folks that qualify, they can this fiscal year, they can have $2,568 to use toward respite. And that respite could be in-home respite, somebody coming in and providing respite so the caregiver can get out of the home. It could be for an adult daycare setting, or it could even be for a 24/7. Let's say somebody needs to go away for the weekend and they need to have a safe place for their loved one to be. It would cover those costs as well. So it's really up to the discretion of the caregiver how they would use those funds. CMS requires that we offer in-home respite in every area we're in, but it's up to the discretion of the participant, the guide participant, to offer the other ones. And we felt it was important to have that benefit, all those options available. So in our 9-county region, we have all those available. And now as we begin expansion across the state, we'll be working with other AAAs to set those contracts up with respite vendors across the state as well. And then we have a 24/7 helpline. So more for emergencies, but let's say a caregiver is just super stressed and having a very difficult time. We have a number they can contact after hours, on weekends, and they will get a person to speak with. Next slide, please. Participant onboarding. So these are for the patients and the caregivers that are coming to us. We get a referral. We have a referral form that it can be either emailed to us. Folks can call our guide number. On our AIHS website, we actually have a button and they can complete a referral form right there that then comes directly to my team. And we screen it then. And basically screening means we look, do they have the right kind of Medicare? And do they have a cognitive impairment? And if those two things are apparent, then we call and we talk to that caregiver or talk to the patient if they're able to speak with us. And then we'll schedule an assessment visit. In Fort Wayne, generally speaking, we have folks come into our actual clinic in Fort Wayne, but we are able to utilize telehealth. We're thrilled that CMS has seen the value of telehealth for this population. While they're cutting back on telehealth for general Medicare visits now that the pandemic is over, they are allowing ongoing telehealth for guide. And as I told the story earlier, it's wonderful. So we have done some assessments. We had an individual where the caregiver lived one part of our region, the individual in another. So by the time the caregiver did all that travel, it was going to be a full day just to get to Fort Wayne for the visit. And we said, let's just do it telehealth. And so that worked out great. And that is how we will expand into the other parts of Indiana as well. Our clinical team will handle those telehealth visits. And then we're contracting with the AAAs to do a home visit. Everybody must receive a home visit. So we'll have the AAAs in the other areas do that home visit so we can do a safety check and just put eyeballs in the environment. Once that assessment's done, we send all that information off to CMS. They align the person to our program, excuse me. And then either our care navigator or the AAA we've contracted with will call out and schedule the in-home visit for follow-up. And then based on sort of the situation, as I said, the care navigators then will follow up on a monthly basis with that caregiver and patient. Next slide. So our team, I talked mostly about all of this. The nurse practitioner does the clinical side of eligibility. She works very collaboratively with other healthcare providers. If there's a PCP or a specialist involved, she will, email, talk to those folks on the phone, provide information back to the primary care provider so they're aware of what's going on with us at the clinic. We can manage medications. We do medication reviews. We refer folks back to a PCP if there are questions about a medication that isn't necessarily a dementia med. So it's not something we're managing, but we can refer them back. And then we also do advanced care planning. Advanced care planning is part of one of the requirements of the GUIDE program. And so all the folks that come to us that have not done advanced care planning for end of life, our nurse practitioner is able to do that piece with them as well. And then our care navigator does the non-clinical assessments, so caregiver stress review, those kinds of things. She assists in establishing the program with the caregiver, provides ongoing support, and then connects the caregiver and the patient to needed services. Do they need transportation? Do they need home delivered meals? Do they need, whatever the case may be, she's able to do that. Next slide. We saw our first patients. We were supposed to open July 1st, but you know how opening things go. We had to wait a little bit of time for CMS. I don't know if you've heard, but things have slowed down a little bit at the federal level. We had to wait a little bit to get some of our things in line with CMS, but August 11th, we started with our first patients and we began serving just in our region. Currently, we have, and this slide's a little bit outdated, we're almost at 40 aligned now to the program. So we're thrilled with having that many folks already seeing the benefits of the program. And as I said, we're working on expansion. We are contracting with several AAAs we have already in the works. One of the pieces, again, is once a AAA decides to work with us, then we have to submit all their information to CMS to have CMS approve them as a partner organization for GUIDE. So we've got several in that process right now, and we'll contract with them for that home visit. Next slide, please. These are just some pictures of our team. The person at the door is Kelly, our nurse practitioner. The person she's saying hi to at our clinic is Kelly. We like to keep things simple. My other staff person who is, as of Monday, promoted to the clinic manager. And then the other pictures, we had a great open house. When we first opened the clinic, we had, oh my goodness, over 50 people in a 2 to 3 hour period. So this is us showing off the clinic space and speaking with those folks that came to visit. Next slide. And so this is how to make a referral to us. So as I said, the referral can come through our website. There's the address for our website. We have a direct email to our GUIDE team. And there's our GUIDE email address. We have a phone number separate for GUIDE from AIHS. That's our number. And we are now we've moved up to QR code. So there's our QR code that will get you to the referral form as well. And the other nice thing is there's no need for a formal referral. So your doctor does not have to refer someone in. We've had people self-refer. We've had folks, as Angel was talking about, or someone was talking earlier about the police department, the fire department. Our referrals come from all over, and we follow up on every referral that we receive. Next slide, please. That might be the last one. Oh, here's our building. There's our clinic building. We're located, as I said, in Fort Wayne. It's at 3003 Lake. And we are already in the stages of what's next. We know we're going to outgrow this building very soon. So we are determining what's next for clinic space and what expansion looks like. And do we expand a little bit, or do we expand for the future, which we think that it's probably a better way to go, is to really plan for the future. So it's very exciting times. And I'm going to stop talking because I could also talk all day, but my throat is not cooperating with me on that. So what questions are there? I'm happy to answer questions.
I don't have a question, but just a comment. This is Shannon Neffler, Director of Geriatric
Hi,
Programs.
Shannon.
Hi, Chris. So great work. Love everything that you're doing, especially implementing IU's model of care, aging brain care. And just wanted to highlight so that commission participants understand the full scope of the GUIDE program in Indiana. There are a total of 3 active sites. So that also includes IU Health and Eskenazi that are also implementing ABC. So just wanted you all to know that.
It is so wonderful to see healthcare and social services working together. I think you've heard me rant on that before, and this is just wonderful. This is innovative, and I'm just really hopeful when I see programs such as this emerge. Now, this has some federal funding attached to it, and what I think is there's so many of us who are baby boomers, we can't just cut our way out of this century. There's too many of us. We're going to have to figure this out. So this is one ray of hope in all that's going on right now, and so we'll see. I mean, there's a lot to be developed here. I mean, I could see we're going to be bumping into one another a little bit. We got to work out some things and find our synergies. And I'm going to be asking some questions of the AAAs in Indiana, how we working together on some of this. I'm going to put my consumer hat on for 2 minutes and then be quiet. As a consumer, I just experienced this. Go to a neurologist and said, well, we're not real sure here of a lot of things. We'll see you in 6 months. And that's it. And my primary care is saying, well, yeah, I don't quite know what you need. Now, we live up in a rural area, Tipton County. It's a desert. It's a wonderful area, but there's no services up there. And, you know, I'm not alone in Indiana. There's a lot of Indiana like that. And it's very hard to get services when you've got you're living with someone with dementia. Very difficult to get support services. And I live in Area 5's planned service area. My provider's in Hamilton County, so that's Socoa. And we just, you know, as we work through some of these things, and we've just got my husband connected down at Eskenazi. So we got that in play now. So now we're all over the place. But anyway, we're working through these things. We're learning as we go. But the hopeful part is we've got a vision emerging, and we're going to find our way through it and have to learn how to work together with it. But it's emerging, and I think we need to give ourselves time to develop some things, but it's coming, and that's the hope. And so we work together. So thank you so much for your presentation here, and we'll watch this develop and learn together. And I'm sure we've got other innovative things happening across Indiana that hopefully we can bring some of this together and present. That's what I'm hoping the Commission on Aging can do here with this. So thank you so much for your presentation.
Thanks for having us.
Hey, Joanne.
Yes.
Joanne, can you hear me?
Yes.
I just want to say one simple thing. You know, my dad, I had a guardianship of my father, and he had early onset Alzheimer's. What you guys are doing today is amazing. Because when I got my dad, we had nothing. I mean, we're talking zero help. So just a little bit of help to caregivers even if it's as much as you guys are doing, is an amazing thing right now.
Thank you.
Anything
I
else?
too come to this with a passion of a grandfather who had dementia. And so really try to see it from the caregiver perspective as well, and know how important it is. And even as a healthcare professional, you feel as if you know things, but when you're put in that role of caregiver, it's like you forgot everything you knew, because now you're the daughter, or you're the granddaughter, or, you know, in my case, last year I had to help my son, my adult son. I was the mother. So having that support for the caregiver is such a vital piece to this program.
Because you know what? You go from being the daughter and your father, and then now the father is the child and you're the adult. And it is very confusing. It is very upsetting. And I will be very honest with you, I'm very thankful that I'm doing this on Zoom and not there today, because I'm crying my heart out.
Thank you for being here with us.
Okay, thank you so much,
Thank
everyone.
you.
Erin, and that's all right. We may have some very brief, we always do that at the end of the meeting. There'll be a little brief at the end, but that's all right. Erin, let's hear about what's happening with the Bureau of Better Aging.
Yes.
SSA.
And I do want to acknowledge, I understand there's some feedback online. We're working on it. Not exactly sure what's going on, but apologize, trying to figure it out. We did just recently turn down the mics, so maybe that's helping. Just a few updates from FSSA, and in particular, the Division of Aging, or the Bureau of Better Aging. Wanted to start with briefly talking about our statewide conference on aging, celebrating innovations in aging, that we held at the end of October. It was the first statewide conference that we held in over 2 decades, I understand. It was really well attended. There was a lot of enthusiasm. Wanted to thank everyone who was able to attend. Recognize Shannon and Kim, who presented, and also Dr. Burke, who gave one of our keynote addresses. And she very eloquently, and I think we heard a little glimpse of it today, her passion for just really recognizing the environment that we are in now, and the importance of really trying to be innovative at the local level. So thank you again for being a part of it, and for everyone who was a part of it. We are planning to do another conference next year, so more information to come on that. We have been working with OMPP. I know that there has been a request for participation from OMPP at the last couple of Commission on Aging meetings. They were not able to attend today. They will be here at the January meeting, and we're working out a schedule for the remainder of 2026. I think at least at a minimum on a quarterly basis, they will be attending. I know that there are outstanding questions about the quality and member perspective regarding pathways, the informal caregiver assessment. So I do have the list of the questions that have been raised that I have shared and will share again with OMPP. So I just wanted to make sure everyone was aware that we are working on that. Wanted to remind you all of the HCBS waiver waiting list dashboard. I will send out updated information and make sure you all have the link. It's updated on a regular basis. Currently, I believe there aren't any on health and wellness that are showing, but there are some numbers on pathways, but I will share those with you after the meeting. Really wanted to spend a little bit of time, I'm going to try and go quickly, talking about the multi-sector plan on aging and the work that the BBA Division of Aging has been doing to gear up for bringing the MPA to the forefront. We had a presentation on the multi-sector plan on aging in January of last year, right about the time of the change in administration. If you'll recall, this was launched in conjunction with AARP by the Division of Aging. It's called Age Forward Together, a unified vision of aging for all of Indiana. It was put together through 5 work groups comprised of a cross-sector of partners from across Indiana. We really came together to shape the plan, and it's a 10-year strategic roadmap for Indiana, looking at cross-sector of life in Indiana. With the restructure of the Bureau of Better Aging and the merger of the Division of Aging and the Division of Disability and Rehabilitative Services, which we expect will become formalized through this upcoming legislative session, we've really been trying to build the foundation of being organized in a way that will be able to better move this work forward. So we expect after the first of the year to really start strategizing some actionable steps for how we're going to take this plan, which has been approved by the current administration, and really move it forward. And a part of this, or I guess related to this, is we are also working on our 2027-2030 state plan on aging that we submit to the administration on aging. And we are really working to align the plans as much as possible. So we are all kind of moving forward in a common direction. The state plan on aging, and I talked about this a little bit, and you can go to the next slide, Rebecca. The state plan on aging has really specific requirements that we need to make sure are reflected in the plan. The multi-sector plan on aging is built upon 4 pillars: age-friendly community, reducing barriers, each journey supported, which is really kind of looking at connectedness, and then reframing aging. So as we're approaching our state plan on aging, we are trying to build it upon these 4 pillars. So again, so we're moving forward in a common direction. Our plan is to have the draft of the 27 through 30 state plan out for public comment in March. So I anticipate we'll be talking a little bit more about it at our January meeting. Are there any questions? Okay, that's all. Thank you.
Thank you, Erin.
I'm sorry, Erin. So sorry.
Kelly had to think for a minute.
Get you some. I'm getting your steps in for you. Who with the reorg? I understand you guys were trying to sort through, but who owns the MPA from the state perspective?
So Vanessa Convard will be our primary point of contact in conjunction with working with AARP.
Okay.
So we've had a few, I shouldn't say few, at least a couple of conversations with AARP about how we're moving forward, but it'll be a primary focus of Vanessa's role.
Okay. And I'm so sorry. Can you remind me what Vanessa's role is?
In the future state, she will be our Director of Policy and Strategic Initiatives.
Okay. Okay.
Currently, she wears very many hats.
Well, that's why I think I've been a little bit confused.
Mhm. Yes. So her role will look different as we restructure.
Okay. Thank you.
Mhm. Any other questions? Thank you.
Erin, I had a quick question. Sorry.
That's
Sorry.
okay.
I know I tried to grab you before you started moving. You had said that you're working with OMPP to have them come and present. And I'm just wondering if and maybe this is for later in 2026, but each of the MCEs that are in Pathways have specific dementia care initiatives that they run. And I wonder if that might be something worth presenting to the commission. I would guess probably after rebid. But that might be interesting for everyone to hear kind of what each of the MCEs is doing on the dementia front as part of their Pathways program.
Okay. Yes, thank you. I made a note of that.
Okay, thank you. Very important aspect. Okay. For our advisory committee reports, as I asked the executive committee to come together and we get ready for our January meeting, I think we'll probably take a look at our work groups here and see if we need to make any changes in any way, put some of them together, add, whatever we need to do here. We'll have a discussion about it and bring it into the January meeting. We need to make any revisions here with our work groups, our advisory committee reports. The Living Longer, Living Better Collaborative aligns very much with the multi-sector plan on aging, some of the things that we're doing there. So we'll be exploring a little bit along with, I've asked Tina McIntosh to co-chair that along with me because I am I currently am chair of the commission. So we'll be exploring what we might do to work collaboratively with Vanessa at the state level on that. To support some of the work that's going there and do some advisory there, work with our area agencies on aging, bring them into that. Shared decision making, do you have any updates on that, Judith?
I do not.
Okay. Deb, anything on emergency housing?
No, that if you recall, that all kind of got put on pause simply due to the fact that APS kind of went away and it's now something else. So I don't know if that's something we want to reinitiate once everybody kind of figures out what that structure is going to look like. And so, yeah, it's been on pause.
Okay, thank you. Kelly?
No significant updates. We moved to meeting every other month. And I think what I would say about the Family Caregiver Advisory Committee, Dr. Burke, is most of our meetings are really focused on, obviously our focus is on family caregivers, but changes that are happening across the state and in the state with organizational restructures and ownership of waivers, the pathways and rebid, and like all of the types of things that are happening that we know directly impact not just the waiver participant, but their caregiver who's trying to help them navigate those changes. So a lot of talk in our November meeting just about pathways, I'm elated to hear OMPP will be joining the conversation going forward. I really appreciate the update that we're continuing to pursue, Aaron, with OMPP on the requirement of an informal family caregiver assessment, which I have always been under the impression was mandatory and understand is not being delivered consistently across the AAAs or in most instances at all by the managed care organizations. So no specific update, just letting this group know that that's where a lot of our focus is just making sure that we can help family caregivers across the state stay informed on the changes that are happening.
Okay, that's one. We have really tried to strengthen family caregiving supports in Indiana. We want to keep working on that. So thank you, Kelly. Dan, do you have anything to add on housing supports? Not sure he's on.
I don't think Dan was.
Or the senior. I don't think he's on senior center. Okay, so we'll keep. The executive committee will meet and talk about advisory committee reports and reach out to chairs and we'll move forward at our January meeting if there are any changes. Okay, Hannah, please come and talk with us about I-4A.
All righty. Good morning, everybody. I will be brief. The federal update is we are now back open, thank God. So longest federal shutdown in U.S. history, but we are back open. However, the funds for certain programs are only funded through the end of January, including the Older Americans Act. And so we are currently working on getting the Older Americans Act not only reauthorized, but funded before January 30th. The Yellow Dot program. So again, this was a new law that was passed just this year where individuals can go and get a free packet from an area agency on aging or a BMV location and put a sticker on the back of their vehicle. And that alerts first responders to important medical information that is located in the glove box. So an update there. We have been working with the Bureau of Better Aging and AARP to help implement this. We have been educating first responders and AAAs. We've traveled the entire state. The Bureau has been helpful in designing the Yellow Dot packets, and AARP just this week sent the packets off to the printers. Again, this was an unfunded mandate. So AARP has been very kind enough to fund this first round of packets. They projected roughly 9,000 would be printed statewide, which we know that that's not too many. However, AARP has gone above and beyond and increased their funding to get 15,000 packets printed. So once those are done being printed, which will hopefully be the very 1st of December, I will be going and distributing them to each of the AAAs at the beginning of December. And so it should be kicked off by the end of the year. And then the last thing I have is the legislative session. It is technically ceremonially kicked off with Organization Day just this week on Tuesday. As of right now, if you haven't seen the news, we are expected to come back January 5th. Now that could be up in the air depending on if the House and Senate decide to actually reconvene for a special session. But right now, January 5th is what we are hearing is our date that we will come in for a very short session. We are anticipating a end of session as of February 27th, so very short session. Some of the major priority bills that are going to be focused on this year is cleanup to Senate Bill 1 from this past year, which is really around local government funding, which some of the AAAs do receive transportation and other funding from their local government entities, as well as cleanup from Senate Bill 5 from this past year, which is really focused on how the state contracts with various organizations. So this will be crucial for us to keep an eye on, just as there's a lot of contracts out there that are with the aging population. So the Pathways program and case management are just a few to mention. They will also supposedly be addressing utility rates. We want to ensure that the aging and disability populations are able to access affordable utility rates. And then we will be keeping an eye on FSSA's aging agency bill, which will be supposedly updating the state statute on the formation and structure of DDARS and the Bureau of Better Aging. So the current practice that they are currently the Division of Disability, Aging, and Rehabilitative Services. They're just going to make that actually in state statute. I-4A does not currently have a standalone bill like we usually have. We are actually focusing internally and administratively on the structure of our association, how we can better do business with the state, stakeholders, and other partners to just better the services and supports to Hoosiers that are aging and have a disability. And I'm happy to take any questions.
There was to be a study out of the legislative session last year about the number of AAAs. I'm trying to remember, and the structure of the AAAs.
Yes.
Is that, I don't remember what the actual directive was inside the legislation.
Yes, so it's to look at the map of the current structure of the AAA service areas. Yeah. And so the ball is in FSSA's court.
Okay.
And so I don't know, Erin, if you want to touch on that.
We have mapped out the timeline if the results of the study do recommend a change in the structure of the planning and service areas. It's a multi-year federal and state process to actually implement any changes, but we anticipate early next year getting started on the study, just looking at at data and information about potential options.
Okay, thank you.
Mhm.
Any other questions or comments related to I-4A? If not, thank you so much, Hannah. Wow, 1 minute till 12 or thereabouts. Okay, well, if we have no further business in front of us, I want to wish everyone happy holidays. We are coming up to that period of the year. And I understand by the end of next week, we may even have a taste of winter here. Some people love winter, some don't. But anyway, we're going to get it anyway. So it was a wonderful meeting. Good to hear from some very wonderful, innovative things happening across Indiana. And so we continue on. We will see you in January. Happy holidays and Happy New Year, everyone. We'll see you in January. Meeting is adjourned.